Now I am going to tell you about the spleen. In the exam you can get a separate spleen. Also you can get a combined specimen of spleen, pancreas and duodenum. From there also question will be asked from the spleen. The spleen is the largest lymphoid organ in our body, which is situated in the left hypochondrium, in between the diaphragm and the fundus of the stomach, behind the mid-axillary line, at the level of 9th, 10th and 11th rib, where its long axis is parallel with the axis of the 10th rib. So what you should do in the exam, you should always hold the spleen like with these three fingers, 9th rib, 10th rib and 11th rib. So you can see the long axis is parallel with the 10th rib. This way you should hold the spleen in the exam. It is purple color or wedge shaped. It can be tetrahedral or triangular, but in maximum cases it is wedge shaped. It is having two ends, anterior end and posterior end. Anterior end is a little broad and posterior end is smaller and blunt. Three borders, superior border, intermediate border and lower border or inferior border, and two surfaces, diaphragmatic surface and visceral surface. It is also having two angles, that is the anterobasal angle and the posterobasal angle. The anterobasal angle is formed by the superior border and the anterior end, and the posterobasal angle formed by the inferior border and the anterior end. But this anterobasal angle is more clinically important, because when the spleen is enlarged and felt below the costal margin, so that time it is referring the anterobasal angle. Now coming to the borders, we know one is superior border, intermediate border and inferior border. Superior border is separating the diaphragmatic surface and the visceral surface. Inferior border is also separating the diaphragmatic surface and the visceral surface. Superior border is at the level of T9 rib, whereas inferior border is at the level of T11 rib. Most important thing in the superior border is the notches at the anterior end. When you hold the spleen, you have to see, you cannot hold like this way, you cannot hold like this way. Once you see you are getting the notches in the anterior side of this upper border, so that means this is the actual position. So this will be the anterior end, this will be the posterior end. You cannot hold it like this way. You are not getting notches, and this is very sharp in the upper border. You have to hold the spleen in anatomical position in this way. So this will be the superior border. We are getting the notches on the anterior part of the superior border. This is indicating that the spleen is developed from the lobulated mass of the mesenchyme cells, lymphoid tissue. They are also called spenunculi. Now we are getting the inferior border. So that is separating the diaphragmatic surface with the visceral surface. And here we are getting the intermediate border, which is dividing this visceral surface into gastric impression and the renal impression. Here we will get the hilum of the spleen. As different structures are related with the spleen in the visceral surface, we will get different impressions. So here the fundus of the stomach is coming, so that's why this is the gastric impression. Here posteriorly the kidney is coming, so this is the renal impression. Here the transverse colon coming and taking a turn, so that is the left colic flexure, so this is the colic impression. And in between the hilum and this colic impression, we know the pancreas is coming like this way, so tail of the pancreas will be here, so that is causing the pancreatic impression. So in the visceral surface we are getting gastric impression, intermediate border, below renal impression, hilum of the spleen, the pancreatic impression, and here we are getting the colic impression. Now I will discuss about the relations. First is the peritoneal relations, then the visceral relations. Regarding the peritoneal relations, we know the spleen is fully covered by the peritoneum except at the hilum, from where the two ligaments are connected with two organs. One is the stomach and anterior surface of the left kidney. The ligament which is connecting the stomach, that is the gastrosplenic ligament, through which the short gastric vessels are running. And the ligament which is connecting the spleen and the entrance of the kidney, that is called lienorenal ligament. So through which the splenic vessels, tail of the pancreas and the pancreasplenic lymph nodes are there. So we know in between these two we get the lesser sac. So you can imagine here the stomach is there, gastrosplenic ligament, here is the lesser sac, here the lienorenal ligament, where the other structures behind the stomach which are forming the bed of the stomachs, they are there. Now regarding the visceral relations, we have already discussed the visceral surface, different impressions are there where the viscera are connected with the spleen. This is the gastric impression where the fundus of the stomach is there. This is the renal impression where the anterior surface of the left kidney is there. This is the colic impression where the left colic flexure, and in between the colic impression and the hilum we are getting the pancreatic impressions. So now coming to the diaphragmatic surface. We have already seen diaphragmatic surface is just opposite to the 9, 10, 11 tree. So it is related with the diaphragm as well as pleura and lung. So we know up to the T8, 9 level, lung is coming. Up to this 9, 10, pleura is there. So that means in between the 9 and 10, we are getting the costodiaphragmatic recess, and which is ending at the level of 10, and below where we are getting only the diaphragm. So this is the relation of the diaphragmatic surface. So you can see again how I am holding the spleen with these 3 fingers where they are corresponding with the 9th, 10th and 11th rib. In this context, we should know the phrenico-colic ligament. So you can imagine the transverse colon is coming like this way and taking a turn. So this is the impression for the left colic flexure. So there is a peritoneal fold which is attaching the left colic flexure to the diaphragm at the level of rib. 10 below the spleen, which is giving support from below. So that is called phrenico-colic ligament. It is also called sustentaculum linis. So that is phrenico-colic ligament on which the spleen is getting supported from below. Regarding the arterial supply, we know spleen is supplied by the splenic artery. If you imagine here, spleen, pancreas is the stomach, is the kidney. So here we will get the abdominal aorta, vena cava in between the vertebral column. From the celiac trunk, the longest branch is coming, the splenic artery, through the lienorenal ligament, and after entering into the spleen, it is dividing into superior and the inferior branches, keeping an avascular zone in between. So splenic artery is quite tortuous because distension of the stomach, movement of the spleen, movement of the diaphragm will not hamper the flow of the splenic artery. That's why the splenic artery is very much tortuous. And the importance of the superior zone and the inferior zone, if any time spleen is injured, surgeon can remove one part but the other part can work properly. So that is the importance of the arterial supply of the spleen. Now coming to the venous drainage. The veins of the spleen drain through the 5 or more tributaries, and at the hilum the splenic vein is formed and it is running behind the pancreas, and at the neck of the pancreas it is joining with the supramesenteric vein forming the portal vein. The tributaries of the splenic vein are short gastric veins, left gastroepiploic vein, pancreatic veins and the inframesenteric vein. So you can imagine here, pancreas is there, from the down, the inframesenteric vein is coming and draining to the splenic vein, posterior to the pancreas, the pancreatic veins, then the greater curvature of the stomach, so you are getting the short gastric veins and left gastroepiploic vein. So these are the tributaries of the splenic vein. Regarding the lymphatic drainage, splenic tissue proper has no lymphatics. Regarding the nerve supply, spleen is supplied by the sympathetic nerves which are derived from the celiac plexus. We know here the celiac trunk is there, around the celiac trunk, celiac plexus are there. From there, sympathetic nerves are coming and supplied to the spleen, which are supplied to the blood vessels and the smooth muscles which are present in the trabecule and capsule. So this is all about the blood supply and nerve supply of the spleen. Now regarding embryology, the spleen is developed in the upper part of the 2 layers of the dorsal mesogastrium from a number of condensations of the mesenchyme cells. So this condensations of the mesenchyme cells also called the splenomegaly. So these separate masses of the mesenchyme cells, they condense and form the lobulated spleen. That's why we are getting the notches in the anterior part of the superior border. And when this mesenchymal mass they fail to fuse, so that time there may be a chance of forming the accessory spleen, and which we will get in the derivatives of this dorsal mesogastrium. So we can get accessory spleen in the gastrosplenic ligament, lateral ligament, in the greater omentum, and sometimes we can get in the left broad ligament of the uterus. So this is all about the spleen.